everyone. Welcome back for another episode of Laughter Through Tears, the 120 podcast. I'm your host, Jackie. I live in Central Maryland. As some of you know, I have chronic conditions, hypermobile Ehlers-Danlos, I have Crohn's disease, I have POTS, I have osteoporosis, and also I'm a septic shock survivor. And this month, we're recording this in May, and May is a couple of things. But it's sort of like I saw someone on social media describe it as the Super Bowl of awareness months, and I really think it is, because it's osteoporosis and bone health awareness month, and it's maternal sepsis week also falls in May. And the big one that we are here, my guest and I are here to talk about, is Ehlers-Danlos Awareness Month, and that's a real biggie here. So, and that's, like I said, the purpose of having my wonderful guest here today. It's been 5 years for me being a septic shock survivor. She also has some connection to that we're going to get into. And so, 5 years ago, I had undiagnosed diverticulitis. It led to colon perforation and got me flown to Baltimore to shock trauma to take care of all of that and save my life. So here I am. I wanted to start this podcast last year. I actually started it on about a year ago now on May 22nd, 2025, because it was commemorating my 4th life day, and I wanted to start something to give all of us with chronic conditions and disabilities and sepsis survivors and scientists, start everybody a voice and to give rise to our voices. So that's why we're here. I'm glad that you're here. I am so thankful for all my subscribers and people who keep tuning in. Thank you very much. I think you're really going to get a lot out of today's episode. So moving forward with that, I have with me Giselle Toscano, and I just recently met her on Instagram. Instagram is sort of like the community for all of us with these chronic conditions. It's an active and a thriving community. I have met incredible people through that platform, and Giselle is one of my most recent chronic illness buddies and warriors and sepsis related people that I have met, and I'm very excited to have her here today. She is a young mom. She has hypermobile Ehlers-Danlos Syndrome. She's endured years of surgeries for everything from multiple ileostomies and intestinal surgeries to winding up in septic shock in the ICU when her son was only 2 years old. At only 34, Giselle has been diagnosed with congestive heart failure, HEDS, hypermobile Ehlers-Danlos Syndrome, migraines, endometriosis, POTS, fibromyalgia, spinal stenosis, and that's just to name a few of her ongoing struggles with chronic conditions. She's had 16 surgeries and counting, and as many of us know, those of us with chronic conditions are at higher risk to develop sepsis. Giselle fights every day, mostly for her young children, and I'm a mom too, and I can totally understand that. She's fighting for visibility, for answers, and for hope. She's taking part in the Light It Up Challenge this month. It's hosted by the Ehlers-Danlos Society, the wonderful society that provides us with so many resources and support. And she has submitted requests to have the Empire State Building and Governor Mario Cuomo Bridge light up orange for EDS on May 4th. Thanks to the Ehlers-Danlos Society and its steadfast commitment to raising our voices and helping us to raise awareness. And like I said, I just discovered Giselle a few weeks ago on Instagram. And Giselle, did the light up happen already? It's past May 4th now.
Yes. Hi, Jackie. First of all, thank you for having me, and thank you for everybody tuning in. It happens already, and the Empire State Building did not get back to me. They're very difficult to get a hold of. And I spent a lot of days. Yeah. I called and I called and I called, but no. The Cuomo Bridge, somebody said they would get back to me too, and nobody ever answered. I know I spoke to someone in person last year who did light it orange, but it wasn't on May 4th and was on a different day. And they did say if they don't get to it by May 4th, they can get to it another day. So I'm hopeful that it'll still happen.
Yes.
I am lighting my house, my balcony, orange, and I put up like a big orange rope light all over the place. There's a picture on Instagram somewhere, but I am going to upload a new picture. And I actually drew a zebra ribbon on the doors out there because I live in a complex. And when everyone passes by, I'm the corner house, so you can see everything when you go down that street and you're kind of turning. And people have questions. They're like, why the ribbon? Why the color? So that helps me talk about Ehlers-Danlos syndrome. And not only that, just invisible diseases, also rare diseases. And it just raises awareness. So I'm kind of doing my part in my community as well. And I hope that people have questions. And they do. They've asked me.
That's
So I'm
amazing.
trying.
Well, you just gave me, and I'll bet a bunch of people tuning in, an idea, because I tried to get, was it our state house lit up last year in orange. But like you said, these places get so many requests. It's extraordinary.
Yeah.
And by the time they get to your request, May 4th is often passed. And
Yes.
so it's in trying to do that. I love that you opened another door and went around another way.
Yeah.
And you're making people aware just because they're asking you, why the ribbons, why the zebra? And
Right.
you have a beautiful zebra on your shirt. And
Yes.
we're going to talk about this in a little bit, but you have the zebra and the zebra blanket. The zebra blanket's
I
there,
have
right?
my zebra blanket here that
Yes.
I've had for years since I was a teenager.
Yes, and Giselle has an incredible story about that as well. So
Yeah.
we are going to get right into it here. Giselle, the things that you deal with, it's mind blowing that you're so young. And we were discussing right before we started to record that, Giselle doesn't look sick. I don't look sick. And if there's one thing I want to see society realize is that disabilities are not all visible. They are, many of us are hidden unless we tell you or you tune into a podcast like this.
Yes.
When did you start to notice that you were different, that there was something wrong?
So if I look back on it, my childhood was very, very different from everyone else's. But everything started when I had my son already. I had him at the age of 20. And around 22, I started feeling heart flutters and things like that. So I started getting tested. My intestines were also not working. It was mainly my large colon. And they told me that it was just a dead organ and they had to take it out. So I started having surgeries at the age of 23, and that's when I got diagnosed with congestive heart failure at the age of 23.
Oh,
Now,
my goodness.
a lot happened that year because I had 5 surgeries within the first year, and it was all intestinal complications. So I could say in my 20s, but when I look back, I would get pulled out of school for physical therapy every week. And I was in the hospital ER every other week for gastrointestinal issues. And I thought it was normal. As a kid, you think, okay, well, this is normal. I didn't ask questions. And my mother was fighting for answers. I remember now how much back and forth she went through with me. And back then we didn't have the medical advances that we do now. So she got a lot of, I don't know, growing pains. She ate something, stomach ulcers, and, just things like that. But we didn't really get an actual answer until now that I'm connecting all the dots. And I'm telling her now, and it's kind of closure for her too, because she struggled a lot with me. But yeah, I guess I've known all my life, but I didn't notice,
I hear that
and
a lot.
yeah. And speaking with my sister-in-law, it was funny because I'm like, I've had IVs maybe thousands of times. And she's like, I've never had a single one. And I'm like, that's insane. Like the fact that there are people that go through life without having a single ER visit or an IV, or my husband, he's never really been to the hospital. He's never had an IV. So it's like, wow, that kind of life exists.
Never had a surgery. People who've
Never
never
had
had
a
a
surgery.
surgery don't have any scars, and
Yeah, no pain.
yeah, no pain. And you said something that I do hear a lot, that it was not normal, but we think it's normal, especially when we're younger and we're growing up.
Yeah.
My thing was, it's not normal to throw up every time I go on a merry-go-round, or when I go on the spinny things in the playground.
Yeah.
And yeah, I mean, and the migraines, like, I don't even think they called them migraines back then, but headaches and the stomach problems. And
Yes.
so you thought that was normal too.
I thought it was all normal. And if anything, I thought I must be eating something wrong. I was a very big chips person. So I would, come home, get out of school and get a bag of chips. And that would be my wind off from school kind of afternoon. And I was like, maybe it's that. But, you know, everyone eats chips or candy or ice cream. And it doesn't affect everybody the same way. It wasn't the chips. There was something deeper there. But yeah, I spent a lot of time getting x-rays as a child too. If I could count the amount of x-rays, I mean, I'm terrified now because I'm like, so much exposure.
Yeah.
I don't know where that's going to lead, but as a kid, I did get a lot of x-rays because of scoliosis and a lot of back pain. But they said, scoliosis causes pain. It's fine. It's normal. It's mild, so she'll be okay. But, my spine now is compared to that of a way older person. So it's like they didn't catch this back then. And I think they didn't further investigate because I was young, which is how I got here, actually. Nothing was further investigated because I was young.
Right.
Which is very upsetting, and that's what I fight for now. Like, age doesn't mean a thing when you're chronically ill. It can affect anyone at any age at any time. So let's fight for answers and more testing, because then it can lead to serious complications, which happened with me.
Yeah, getting that thing, some people say, but you're too young to be sick. There's no age requirement to have an illness.
But I think that there's, I know that people struggle with what to say.
Yes.
And it's sometimes when they say, but you look great. And it's like, I don't take it in a bad way, because you really don't know what to say. Like, damn, that sucks.
Yeah. How dare you say I look good?
I'm a very blunt person, so I rather someone be honest with me, but I know people are trying to be nice. So what they say is, but you look great, but you still look pretty. And I'm like, thank you, but the reality is, yes, this sucks. It really sucks. And it's okay to cry. I've had criers, and it's okay. It's okay to cry. I cry all the time. It's okay to feel sad, because it is sad. And but, yeah, our exterior doesn't match our interior, so I get a lot of mixed emotions there. But it's
roller coaster.
Okay. Yes, it is. And what sucks is, when I got diagnosed with congestive heart failure, I was only 23. And the cardiologist
I wanted to ask you
at the time,
more about that, because to me, like, I hear congestive heart failure and I go, oh my God.
Yeah. So the cardiologist I had at the time, he was, and I want to say this comes into play. He was a male, young cardiologist. And he said, you're young, so you'll bounce back. You're a woman, so you'll do fine. And I think this is because you're having the intestinal surgeries and it's affecting your heart temporarily. And he took me off the meds after a 3-month period. I was getting better. I was feeling better. So with congestive heart failure, you get a lot of fatigue. You get a lot of, I can't lay flat. I can't breathe. It feels like I'm drowning. And the ability, my heart muscle was weak. So the ability to pump blood, it was doing half of its job. With the medication, I did feel better. And then after 3 months, he's like, okay, I'm going to take you off of it because you're young and you're going to do fine. I got significantly worse to the point where I was at risk for cardiac arrest. And then I got a new cardiologist, and he was very smart, and he's like, no, you don't bounce back from congestive heart failure. You need treatment, ongoing treatment. And now you've gotten worse because you were off the medication, so you need a pacemaker defibrillator. So I got one at a very young age. I think a year later after I got diagnosed, I got a pacemaker defibrillator, which is not something that you see in a young person either.
No. You think of like grandpa having a pacemaker.
Right. Yeah.
Wow.
I got one very young, and my son was very small. He was 4 at the time. But that's my point. Just because I'm young, it doesn't mean that I'm going to bounce back.
Yeah.
And he was a doctor. He knew better. He knew better.
Yeah.
So
It's incredible.
It could have been worse with the heart, and I'm just lucky that somebody else, I got a second opinion. It took some time, but I did get a second opinion, and they advised to get a pacemaker defibrillator, which was perfect because I did have cardiomyopathy, and I did that year, right after I got it, I got shocked, meaning had I not had that device, I wouldn't be here today. So just my heart rate was all over the place, and I wouldn't have survived that without my little machine. I don't have that one anymore. It was here where they implant it. Here's the scar. But now I have one that's right here. See that little bump here?
Okay.
This one is new, and I just got it about a year ago, and it's very uncomfortable, especially for a woman.
Yeah.
Because we have our bra and it goes over that spot. And it's a fairly new device that they've tested on bigger people, men usually.
Usually. Yeah.
Usually.
All things are tested on the guys. Yeah.
Yes. So when I got it, they're like, it's a new device. You're going to do well with it. And recovery time did take longer.
Yeah.
It was very, very painful. And they did say, well, you are a smaller person and you're a female, so that's why. And I'm like, well, this should have been tested on females too. Small women. Everyone.
Right. Yeah. That's
Yeah.
like with the seat belts too, right? In the car. I mean,
Absolutely.
they've been sized for men. I get in the car and the thing's like choking me.
Yes.
It's crazy. I think one thing I want to point out here is the importance of getting second opinions and more opinions. Because I got chills when you said, if you hadn't gone for that second opinion and just assumed congestive heart failure was something that was going to miraculously go away because you're young, I mean, you're right. You wouldn't be here. I mean, that's wow. And your son was how old then?
He was 4 at the time. I got diagnosed when he was 3 with congestive heart failure. Yes, he was 3. And he was very young, but it's hard to keep it all together for them, now that I have 2. But it was a lot of, mommy's going to be okay, mommy's fine, all while trying to be honest at the same time. And, he witnessed a lot of me going to the hospital for many reasons. And there was a point where I wouldn't let him visit. He was still too little.
Yeah.
And I didn't want him to see me that way. So we would communicate through FaceTime and, video chat. But I suffered without him for a long time. I've had a lot of surgeries, but that particular year, that was my sepsis year as well. Yeah. It was living in a hospital and not being able to see my son. But I think I saved him a lot of trauma because he does remember most of it. But I didn't want him to see, all the different lines, the central lines, the A lines, all the medications, the machines that they had me hooked on, the blood transfusions, the tubes up my nose. I didn't want him to see all that. So I think I made the best decision for him at the time.
Right. And just like backing up a little, like I said, you grew up knowing, you were different. There were things that you attributed to being normal,
Yes.
and and the medical profession itself, just basically waving a lot of it off when you were younger, right?
Yes. My mom, I was in physical therapy, and when people asked me why, my answer was my back hurts. And that's
Yeah.
all I knew because I was in elementary school. And my back hurts because my spine isn't straight. But there was much more to the story. And my hips weren't aligned, and my feet were kind of crossed inward. And so there was a lot of PT for that. But nothing, no one ever told her why.
Right.
And we didn't have those answers. I mean, now I know the answer, but I just got my EDS diagnosis recently, and they, everything was connected. The heart, well, they're figuring out the heart. They still don't know if the heart is a part of this EDS or not. They did at some point attribute it to pregnancy,
Okay.
but I don't know. I don't.
Yeah.
I don't
I
think
was
so.
going to ask, like,
Yes.
was the heart connected to the EDS? And when you talk about the physical therapy, especially as a young child, my youngest daughter went through a lot of physical therapy. She continued to play sports. She was, which to her detriment, doctors would say, well, you can run across the soccer field.
Right.
What's the big deal?
Right.
And so when you mentioned being in PT and not really knowing why, because yeah, my youngest daughter would be in physical therapy and people would say, why are you going to therapy? Or why are you putting those braces on your knees? And there's no real good answer for that. So it's the
The
darndest thing
braces.
to have, and not
Yeah.
the medical profession doesn't have answers. You don't have answers when people ask questions, and you live in an existence that you otherwise attribute to as, okay, this must just be my normal.
Right. And as kids, when you're having conversations with another kid, they don't continue asking why. They're
Right.
just like, oh, okay.
Okay, you got to go to
Okay.
the doctors. Okay, you
Right.
got to wear those braces on your knees
Yeah.
or
I've
whatever.
never had
Yeah.
one. Okay.
Yep.
Yes, now that you mentioned braces, there were so many braces. My parents went as far as to taking me to Colombia because my parents are from Colombia. Um, and a doctor there, an orthopedic surgeon, recommended casting my legs at the same time. I mean, ha, ha, I had to be carried everywhere. So,
Yeah.
I remember it. But it's like, what kind of a recommendation was that? And when I came back here, the doctors here were like, yeah, that should work, but it really did nothing. Now that we look back, and I'm just like, and my parents, they tried everything to help me, so they were just open to suggestions, everything but surgery, which at that age they didn't want to go through with. I don't know if I haven't asked my mom if surgery was an option. All I know was braces all the time, cast her at once or one leg at a time, or just do it several times. And now that I think back, that's just insane.
Yeah.
I did spend my childhood braced up all the time, so it makes me laugh, but there's anger there, you know?
Right. And just
Um,
to remind our audience too, when we're talking about bracing and everything, Ehlers-Danlos is a genetic disorder defect in our collagen, and collagen is a substance all throughout our bodies, and it literally is the glue kind of that holds us together, ligaments and joints, organs, and when there's a defect, it doesn't hold things together very well. So your joints are loose or floppy, or you tend to dislocate a lot more. And it's painful because they say, like, we're always constantly walking around braced, even if we aren't wearing a brace, like we're bracing to hold ourselves in place. And that's, I wanted to mention that since we were talking about the bracing. And so you didn't have surgeries for any of that, right? When you were
no,
younger?
not when I was younger. Now I've had 2 knee surgeries, a hip surgery, and I have an upcoming hip surgery, which I'm supposed to schedule, but I don't want to give up my summer to
Yeah.
be, it's harder with kids. And
Yes.
I drop them off and pick them up every day. So how am I gonna do this? And then my husband, who is a saint, he will take off of work, but we don't have the luxury of having him take off of work to take care of
Yeah.
me. A healing from a hip surgery can last anywhere from 3 to 6 months. So,
Right.
and knowing my luck, recovery time for us, it's much longer. For EDS patients,
Yes.
it's much longer.
Yeah.
So they give you the time frame for like a normal person who maybe dislocated or broke something by accident. But for us, recovery is much longer.
Right.
So I have that coming up, and I have a big decision to make. And
Yeah.
do I deal with the pain for a little longer, or do I get it out of the way and sacrifice a whole 2 to 3 months with my kids?
Yeah.
It sucks. I've said that word a lot today, but that's the nicest way I
It's
can
an
put it. The
appropriate
cleanest way
word.
I can put it.
Yeah.
Yeah.
And it sounds like, especially the year with the congestive heart failure and then sepsis. Sepsis was that same year, right?
Was this all the same year that I got diagnosed?
And
And
with kids, that's
yes,
monumentally hard.
it was, so when I got told that my colon needed to be removed, I was like, okay, I was excited because I couldn't go to the bathroom for about 2 weeks. And I was like, okay, there's something wrong. The first
So it was like your
two,
intestines stopped, sort of like they
yes,
were paralyzed.
the large one.
The large
Yes.
intestine,
So
okay,
they
which is
called it,
common. Yeah.
they called it colonic inertia.
Yeah.
And they're like, it needs to be removed because it's not working. There's no peristalsis, which means no movement, and everything is just getting stuck in there, and you're going to get a major infection. So let's take it out.
Yeah.
They took it out, and they gave me a temporary ileostomy.
Right.
And I was so amazed at the human body. At the time, before my surgery, I was in school for nursing. So I was just like, wow, this is amazing.
Yeah.
The fact that I can live without a major organ and they can take out another one through my belly, and I had this little bag to collect my stool. I was like, wow, this is really cool. And I would show my son and teach him all about it. And
Yeah.
but then I started having complications, and I started hating my ileostomy because it would often get inflamed, and I would end up, or backed up, and I would end up in the hospital. So
Right. So
I
you'd
was
get like a blockage.
a lot of
Yeah.
blockages,
Yeah.
a lot of blockages, partial blockages.
I had a temporary one,
Okay.
temporary colostomy. When I went into septic shock, they had to reroute everything for 7 months. Blockages are
Yes.
horrible.
Yes.
Yeah.
And the diet restrictions because of the blockages, no peanuts,
No popcorn, no corn,
popcorn.
no salads, no
greens,
basically everything was off the table.
all the healthy stuff, no healthy stuff. And it's really hard because there was one time where I slipped and I had eaten a piece of lettuce. It was in my burger.
Yeah.
And that nearly killed me. It sent me to the hospital. My son was there. He thought I was going to die because I was throwing up and I was in extreme pain. And we were trying everything to get stuff to move, but no, it did land me in the hospital, and I was hospitalized for about 2 weeks. And they were fighting to not get me into surgery for that. So that was successful. But then after that, I was like, can I please be reversed sooner rather than later? Because this clearly isn't working.
Right.
They reversed me.
Yeah.
And everything was okay until it wasn't.
Oh, no.
The scar tissue. I got something called intussusception. So my small bowel, which is the only thing I had now, they had connected it to what was left of my rectum. And now I was going to the bathroom normally. But now the small bowel started to kind of like fold into itself. Kind of like when you fold a sock into itself.
Okay, yes.
And they said that can only be that can only be healed with surgery. We have to fix it. So I was like, okay, here we go. And hernias and all that stuff, just little side things that were giving me a whole bunch of issues. So I went in for a hernia repair, the intussusception, and a hernia. I'm sorry, I said that already. And a scar tissue removal.
Otherwise known as adhesions.
Adhesions, yes. So when I went in, they wouldn't operate on me because of the congestive heart failure. So they said, we're going to hospitalize you for about a week. We're going to put you on TPN, which is just nutrition in the form of a bag, and I couldn't eat anything else. And I was like, okay. I was upset because I wanted my surgery and I wanted to go home, but I understood it was because of my heart.
Yeah.
And then a week later, my surgeon comes in and he's like, I have time for your surgery today. It was a Saturday. I have time for your surgery today, but you're the only case and we're going to go now because I have a wedding later on. And that should have been my first red flag. But I was like, okay, yes, we're going to do the surgery. We're going to do the surgery. I'm finally going to get out of here.
You're just excited because it's going to get done.
I didn't hear anything else.
Yeah.
And obviously now as a mom, if I hear that a doctor's coming in and rushing because they have an event later, I'm going to be like, no, thank you.
Yeah.
I should have caught that, but I didn't. And honestly, it's not my fault either as a patient, you know?
Right.
But I went into surgery. Everything came out supposedly okay. I was in the hospital for a couple of days, and a dear friend of mine he was my nurse throughout this whole thing. He became very close to me, and he was there in my room, and he had a new job in the ICU, and that was his first day. So he came down to visit me on the floor that he used to work on. And he's like, have you eaten anything? And I said, no, I'm not really hungry. I have a lot of pain and something feels weird. I also have a bit of a temperature. They said it was normal. And he's like, okay, let's eat some avocado and a little bit of chicken. And I was like, okay, fine. He's a nurse. He knows what he's doing. So I did get his advice. And yes, I was supposed to eat. So he did the right thing. Yeah. I eat. He goes home. He has an early shift next morning. He's like, I'll come visit you after my shift in the ICU. Later that night, and this was after day 3, I felt as if someone had lit my body on fire, and the pain started in my belly where they had operated. My vitals were going crazy. I can't even remember what was happening because I was just screaming at the top of my lungs, and I was sleeping, so I thought someone had lit me on fire. I was like, okay, someone that hates me just snuck in and just wanted to kill me, and the easiest thing was just to light my bed on fire. That's what went through my mind.
Oh my gosh.
All the nurses, they rushed in, they pulled me out right away, and they took me for a CAT scan, and it all happened so fast. But when I came out of the CAT scan, time slowed down. And they're like, a doctor came to me and she said, you need to call your family in. You need to say goodbye. And I said, what's happening? And she's like, you're in septic shock. So in the moment, I'm like, why? How? I don't even, how did it get to this point? I called my sister.
Yeah.
I couldn't call my mother because giving her that news over the phone, I couldn't call her. She was with my son, so I didn't want to create panic there. Right. So I called my sister and I told her what was going on. She said, okay, I'm going to call mom and we'll be right there. And in that moment, I just, I was thinking, okay, I'm never going to see my son again. They hadn't explained what had happened yet. I was just in a state of shock, and I was also in so much pain that I just wanted the pain to stop. And I've come to a point where saying this out loud is okay, because no one can ever know unless you're in it. You can't know what that pain is like or what that feels like in that moment. but I did want to let go. I was like, I need to get back to my son, but the odds are against me. They said I have a 20% chance of survival at the point that I'm in. And the pain was inexplicable. I have no words, really. And I just wanted I wanted it all to stop. I waited maybe a couple minutes. I can't give you a time frame, but I did wait a little bit because they did call the surgeon that had worked on me. They wanted him because he knew.
Oh, good. He was back. He was back from the wedding,
I
I
guess
guess.
he was back. Yeah, I hope. I guess. Yeah, I mean, it was after day 3, so.
Yeah.
But they called him, and since he had been on my case for a couple of months, and he was my primary surgeon, they needed him there. And I had somebody, it was a young nurse, a guy, I never got his name, but he's like, I'm sorry, he came to my bed, he's like, I'm sorry you're going through this, just try to hold on. And I'm there like, I can't hold on, I'm trying, but I don't know if I can. And then, another surgeon who came up to me, and I had told her days prior, I said, something doesn't feel right. They wanted me to walk because, when you have intestinal surgery or any kind of surgery, I think gastrosurgery, they need you to walk right away, which
Yeah.
I
To
hated.
get everything moving.
To get everything moving, but I hated, and I think I was one of those difficult patients, and I was like, no, I don't want to walk right now. So,
They
but I
did give you
walked.
antibiotics, though, right away, right? You were on
I
probably a
got,
lot of
yeah,
antibiotics. Yeah.
yeah.
Okay.
I don't remember exactly what they gave me, but I was on a
I know.
lot of
Yeah.
things.
I'm
Um,
just checking because I'm
of
like, oh
course,
my God, tell me they gave her
yeah,
antibiotics. Okay.
yeah.
Yes.
But when I was I had surgeries already. So when I was walking, so just something felt heavy to me, and
On
I
that
couldn't
side where you had the
just
repair.
yeah, just like right below my belly button.
Okay.
Something felt heavy, and I couldn't explain it. And I said something feels off, and they're like, it's completely normal. You're going to be discharged tomorrow.
Yeah.
And that same surgeon who said it was normal, she came up to me and she's like, I'm really sorry. I should have listened to you. And at that point, I was just like, I was so far gone. And I was like, okay, I didn't get to say goodbye to my son. I'm not gonna, he's little, so I can't call him and say goodbye. I just, I hope that, he understands that I tried.
Yeah.
And at some point, I do remember, I don't know, I think I laid there and I was like, I can't, I don't know how to fight this. This isn't a fight that I can win.
Yeah.
So I don't know if I gave up, but I'm sorry.
No.
But at the same time, I had just accepted it, I think.
Acceptance. Yeah.
They took me into emergency surgery, and when I woke up, I woke up, so thank God for that. But when I woke up, I was so angry. I was so angry because as soon as I woke up, I felt the bag. I felt the ileostomy on me.
It was back.
It was back. And I was like,
Oh no.
no, I don't want this. I don't want this. I was grateful to be alive, but at the same time, I'm like, this ileostomy is going to bring me so much pain, so much trouble, so many hospitalizations again. And
Yeah.
just everything just came back. And I woke up and I was still intubated.
Oh.
So that was scary because
Yeah.
they're like, don't breathe. And I'm
Yeah, because you have this thing in your
yeah.
mouth.
So they're
It's
like, fight all instincts to breathe. And I'm like, okay, how?
Yeah.
So they had to get me to calm down, obviously. I went into a panic attack because I'm like, how do you not breathe? They're like, the tube is breathing for you. You need to just stop breathing. And I'm like, well, that's human instinct. I don't know how to do that. So that lasted a couple of minutes, just kind of freaking out. And then I was looking around and I see all the machines. I see all the endless medications that they had me on. IVs everywhere. Um, neck, arm, feet, hands, everywhere you can possibly think of, I had an IV.
Yeah.
And my brother was there. He was the first face I saw, and he actually didn't let my mom in because he's like, she's still intubated, and if my mom sees her like this, it's going to be too much. My mom,
Oh
she's
my
very,
God,
she
yes.
can't take, I mean, any mother can't really see
Yeah.
something like that. So he did keep her out for a little while until they took the tube out. For that, I'm very grateful. I don't know if my mom could have handled that. But the next person I saw really was my friend, the nurse. He walked into his shift
Yeah.
expecting a day of, okay, day 2 he was in training in the ICU, and he looks in and it's me. And we had become very, very close. We were best friends at the time. So, I was his regular patient up on the regular floor. So when he walked into the ICU, he had just seen me hours ago, and he just completely collapsed. He wasn't allowed to be on my case. But that messed with his work,
Yeah.
because I was there fighting for my life. And one of the things that he told me that stayed in my mind was that a lot of patients in the ICU, they sometimes don't make it. So I
Yeah.
was, that had stayed with me, and just waking up there was, it was rough.
It's
I remember
traumatic.
that. It's very traumatic. I
Yeah.
remember that. And then there are moments of time where I don't remember. Like being in there,
Right.
I was in there for about a month. And being in there, I don't remember sometimes. I hear that family came to see me or friends came to see me. I don't remember that. I remember my mother, she had a broken toe, and she wouldn't leave my side. She would eat, she wouldn't sleep, she wouldn't go home. She would go clean up in the bathroom in the hospital,
Yeah.
and she would try to. My fever went up to 106. My fevers were very high the first couple days because the infection would not leave my body.
Yeah.
And she would ask for ice and water and just get these like towels and rags and just put them all over my body to try to bring my temperature down. Aside from what the doctors were doing, she wouldn't get in their way, but she was doing her own thing, trying to bring my fever down. And she never left my side. And I think her suffering made me fight harder. And I was like, okay, I can't leave. But this will destroy my mother. And I don't know.
Yes.
I didn't know how much my son knew, but I have to get home to him. I have to try to get home to him because I was saying how much this was hurting my family,
Yeah.
and I couldn't leave my son without a mom. Not to mention I was a single mom at the time. And a lot of people don't know this, but my husband is not his biological father. He came in when my son was about 4, turning 5.
Yeah.
And so at that time, I was alone with my
It
child.
was you and your mom and your little baby
Yes.
boy.
Yes.
Oh my
My
goodness.
my father, my sister, I had a big supportive family, but my mother
Thank
never
goodness.
left my side. I mean, mom,
So,
she's mom.
yeah. I mean, your mother, like, I can't even begin to imagine. I can relate where where you said that, like, that you couldn't hold on. Earlier on, you couldn't hold on even for your 2-year-old. Because there comes a point, I think, like, I felt the same way. I was awake when they intubated me. That
Oh,
was traumatizing. And
yes.
then I was laying there and yeah, like I was looking around like in the emergency room still while the helicopter was coming, and I remember kind of just like looking around, where's my husband? Couldn't really see him. People were working over top of me, and at one point I surrendered, just being like, well, I'm going to miss everybody, but I got to go.
Right.
And I closed my eyes.
Yeah.
And then next thing I knew, the surgeon was talking to me in the ICU. But I understand totally what you said, that you couldn't hold on any longer. It's too much.
It is. It's so much. And I've gotten, but what do you mean you let go? You had a son. What do you mean you let go? And it's like, I'm sorry, you weren't in that position,
Right.
so
You
you
weren't
can
in
ask
your, they
questions.
weren't in your body
Right.
or my, yeah,
You can ask
yeah,
questions, but you have no right to judge. And I did fight. I fought, but no matter how much you fight, even for the people that haven't survived sepsis,
yeah,
sepsis is just, from there, it just, you decline so rapidly that there is no time to fight. It's like
no,
you're thrown into battle without any gear, without any armor, and you're expected to pull through.
yeah.
And it's very difficult. It's very difficult. So, yeah, no, at some point I laid there and I was like, I don't think I can do this. The pain alone was consuming me, and I couldn't even speak. Um, and the shivering, I don't know if you remember any shivering.
Shivering.
It was just severe.
The
I was just,
fever is so bad,
yeah,
and the
the
shivering
shivering.
is like extraordinary, like nothing you've
It's
ever had
extreme.
before.
You can hear the stretcher just, because of the shivering. Your body's moving in such a strong way, and I remember that so much that it stuck with me.
Yeah,
And sepsis, going into sepsis, having sepsis is so traumatizing.
right.
So much so that 11 years later, and I still have PTSD because of it. Uh,
Guilty. Yeah,
yes, and it's
yeah,
completely, I have a therapist and we're trying to work toward, I have a lot of things mentally. um,
right.
and a lot of it stems from the physical stuff that I have going on because they do go hand in hand.
Naturally. Yeah.
But the sepsis itself, if my kids have a scratch, if they get hurt, if they have an infection, I'm just like, if they have a fever, I go into a state of panic.
Panic.
And I don't show them that panic, but I do panic. And I'm just like, we have to get ahead of this and we have to make sure. And I'm like checking them for, things that I'm familiar with as a patient. So that PTSD is still there.
Yeah.
Yeah. So viruses in this house are they come in here and they scare me half to death because I'm like, no, I can't have anything go wrong. And I'm high risk. My daughter's high risk. She's very asthmatic.
Yeah.
So I have a
Yeah.
lot of protocols in place.
And you
But
definitely have the awareness,
yes,
unfortunately, based on your own
yes,
experience.
yes.
And the thing I try to tell people also about, the connection with people with chronic conditions and sepsis, we're at higher risk for sepsis. And, with Ehlers-Danlos syndrome, there's a lot of times, and you've experienced, I think, all of this, where you will have a medical device inserted, you'll have a port, you'll have a lot of surgeries. And that's what increases your risk because all of that increases your risk for infection, like you got the intestinal
Absolutely.
infection from the bowel surgery.
Yeah. And now going into surgery, that wasn't my last surgery. It was the biggest one I've ever had, the
Yeah,
scariest one I've ever had, but that wasn't the last one. And so every surgery after that was major panic. I'm not going to survive. I'm not going to survive. I have a surgery now and I panic. I get spinal procedures all the time where I have to be put to sleep. I panic. Endoscopies, pouchoscopies, which for me are like colonoscopies, kind of the same,
right.
but I don't have a colon, so we call them pouchoscopies.
Oh, I was going to ask,
Yeah,
because you woke up from sepsis and you're in the ICU and you have another
I
ileostomy.
have the second one, 2 out of 3. So I have
But
the second,
eventually it sounds like you had that reversed and a J pouch
yeah.
created.
So a J pouch,
Yes.
yes. So
Okay.
I have the second one, and at this point, I hate it right off the bat. I'm mad at it. I'm angry. I don't want it. Everything that the first one, like all the issues that one was causing, those issues came crawling back, and I was like, sorry, I have something on my. I I was upset. I was angry. And I went home and I couldn't bear to look at the thing, and I got major depression from it.
Yeah.
And I think what people don't talk about really is when you have an ostomy, it does bring down your self-esteem.
It's a major change in how
Yeah,
your body works and functions. And,
absolutely.
you know, I am glad I do see, I still watch them even though I had a reversal, but there's a lot of TikTokers now with
Yeah,
ostomies.
I
And they are
know.
doing patient education and,
Yes,
you know, and I'm all for it because it, there's a big stigma around
yes,
ostomies too.
yes. When I first heard of it, I was amazed. And then after a while, I hated it, not because of what it was, just because of what it did to me.
Yours did not function
It didn't.
clearly, and I wonder if that has to do with having Ehlers-Danlos, which you still didn't realize at the time yet, right?
Not yet. No, I was in the very beginning of this journey.
Yeah,
Not really. I was in the middle because, all the stuff when I was a kid, but I was in the beginning of the surgical journey, and I had no idea that this could have been genetic.
right.
So when I had that one, I had it for only a couple of months, and the depression drove me to a point where I was like, if I don't get this thing off of me, I don't know if I'm going to be able to survive mentally. And I need my surgeon to remove it. And I asked him many times, to which he said his answer was no. But then eventually I did tell him, I was like, I'm very depressed and I can't deal with this. So he removed it. He reversed it. But then the same issues came back. The
It
adhesions,
started to fold in the adhesions.
everything, the adhesions, the
That
the
has to be the
hernias.
Ehlers-Danlos.
I think so, because I was never okay. I was never, it never functioned properly.
Yeah,
And then, he's like, okay, you need another one. You need a third ileostomy, but this time you need to let it just sit there and let everything heal. And I was like, okay. At that point I was just like, okay, I'm just going to do it, and whatever comes mentally, I'm just going to deal with it. So I had surgery again. At this point, I think it was the 6th or 7th surgery. 7th intestinal surgery, where he gave me back the third ileostomy, and I actually behaved, and I was like, okay, I need to keep it this time. It
yeah,
did give me a lot of issues, but by then I was more open to solving them, and not giving up, and not, kind of like I wasn't closed off anymore. I was just like, I have to make this work, because my son, his quality of life, I don't want to be in the hospital at all times, because that affects him as well. So
right.
I was just like, I have to accept it, and I have to do what I have to do. Now, having an ileostomy, I'm, God, the skin where it's attached to was
Yeah.
raw, completely raw.
So you had the skin problems
I had
too.
the skin problem. So the skin
Yeah,
around the ileostomy was raw. Changing
right.
the bag and removing the sticky part, that
Yeah,
would just tear my skin, and it was just always bleeding. It was always giving me issues.
fragile skin
Yes,
with
fragile
Ehlers.
skin.
Yeah,
Which at the time I was told, it's normal with some patients. It happens. And again, I hated it, and at this point I was with my husband now. Like, we weren't married yet, but we were
yeah,
together. But I remember feeling so shy about it. And I was like, you
yeah,
can't see it, and you can't touch it, and you can't,
yeah, yeah,
you can know about it, and I'll tell you everything you want to know, but
yeah,
you can't look at it.
yeah,
I'm gonna leave my shirt on, things like that, that he would often reassure me, that he's like, honestly, I don't see that. I see you. And if you want me to see it, I'll see it. If you want me to learn about it, I'll learn about it. But I don't see it. I see you as a person. So that helped.
yeah,
But dating with an ostomy is very difficult. It's very, very difficult. I mean, dating in general is difficult. You're put in a vulnerable place, and then add a bag of crap literally
yeah,
to your body, and so you're just even more
yeah.
vulnerable. And it was a struggle, but like I said, my husband is a really great person who just loves me for me. So
Right.
I got lucky there. But yeah, that third one, I made it last, and I was like, I have to let everything internally heal. My body had been
Yeah.
through a lot of trauma. I need to let my small intestine heal so that I can, it can function properly. Um, but still, a lot of hospitalizations. In one of those, I did get hospitalized because I had a blockage. And the surgeon came in, and he was very rude. Very rude.
Oh, great.
His
Yeah.
It was the same surgeon, and he was
Yeah.
very rude. And at that point, I was just like, "You nearly killed me, and you have the audacity to walk in here."
Come in here and be arrogant
Yeah,
yet, or
and I'm like,
rude, or anything. Yeah. Oh my
and
goodness.
he's like, I didn't do anything. You know what you were getting into when you had the surgery, and I was like, you were rushing off to a wedding. You
Yeah.
know, I chose not to sue you because I was grateful to be alive and I had a lot going on. And that's something I always
Right.
get. Why didn't you sue him? I wasn't thinking, I was trying to live, I was trying to fight
Yeah.
for my life.
You're trying to survive.
I
Yeah.
was trying to survive. So that wasn't in my mind. And I was very like, okay, things happen.
Yeah.
Mistakes happen. It nearly cost me my life, but I was I was grateful to be alive, but when he walked in there like that and I was having a blockage, I don't know what
You're like,
his
you got
problem
a
was. I
lot
don't
of
know if he was having a
nerve.
bad day. Yeah, but I was like, I'm done with you. Um,
Yeah.
so I switched hospitals. At that time, I was in Mount Sinai in Manhattan, and then I
Okay.
switched to New York Presbyterian in Manhattan. And I
Just very good,
found
I've heard.
it's amazing. The surgeon I found, she saved my life.
Yeah.
she she's only done one of my surgeries, and that was my final reversal. I'm reversed, and she did that one. That was the eighth and final intestinal surgeries that I had for now.
Yeah.
But she came in and she was just like, we're going to wait a little while. We're going to let you get a little better. And I promise you that I'm going to keep you safe. And, she did. I got an infection right after that surgery.
Oh, yeah.
But she
Because you're more
was,
susceptible to
right.
sepsis once you've already had sepsis.
Yes.
Yeah.
But she was
Wow.
amazing. She was at my bedside. She wasn't sending her team. She was there for everything. She was asking me questions. She wasn't, because as a surgeon, you're okay. I get it. You're busy. You send your team or you send nurses, but no, she was there and she was just making sure that I was okay. And she was
Yeah.
always making sure that I was okay. And I always, when I hear of somebody that needs a colorectal surgeon, I send them to her.
Yeah.
So she reversed me, and it was difficult at first, but it's been a couple of years, and I've been reversed for a couple of years, so I think everything is okay.
Yeah.
Recently, though, I think I've been struggling with a little bit of gastroparesis. I feel
Oh,
I
no.
feel like I'm
Yeah.
having trouble emptying.
Yeah.
Sorry, this is TMI, but it's just my reality.
Anybody who's listening
I
here,
know
especially the Ehlers-Danlos people, they're just like, okay, yeah, we've done, and especially
everything.
gastroparesis, which is a slowing of your digestion and
Absolutely.
the movement of the food through your intestine.
So lately, for the past couple months, I've been struggling with that, and my husband's kind of pushing me to go see her, but the fear is there. I'm like, I don't want to have surgery.
Yeah.
The next thing, I had a pouchoscopy recently, maybe last year, and now it's time for an endoscopy, but I just don't want them to search and find,
Something.
because they will.
Oh, God, I feel the same way.
They will.
Don't do that test. And
Right?
one doctor said, why? I said,
You're going to
because you
find,
might find
yeah,
some, you'll see something.
yeah, that's
They're like, well,
exactly
that's
what it
kind of the point.
is. Yeah. That's where I
Oh
am
my
with the
gosh.
intestinal stuff. I do have to go see her. I've been putting it off. I know it's not the best idea, but for now, um, food is moving. It's just moving very slowly.
Yeah.
So I don't think I'm in any grave danger, but I think within the next couple months I need to go make an appointment.
I was going to advise. I'm
Yeah,
the proverbial
I
mother
know.
here, and I'm going to
I know.
advise you. Yes, call your doctor,
I know.
because yeah, you don't want to let that get out of control. But you
Yeah.
illustrate the point very well that when you've been so traumatized by medical traumas, and you almost died, and then repeated surgeries, it's not easy to say,
Mhm.
yeah, I'm going to go look into this and perhaps have another surgery. So
Yeah.
yeah,
I
it's
don't,
very, very hard.
especially in intestinal surgery. I get scared before any surgery, but when it comes
Yeah,
to intestinal surgeries, I mean, I have
they're the
PTSD
worst.
there. Yeah, I have all
Intestinal
the,
surgeries, I think they're the worst too because, well, first of all, you probably have, yeah, I mean, when they cut in through the abdominal muscles,
yeah,
it's so painful. There's so much that they have to go through. And then, you lose core strength. And we struggle with core strength anyway, having
exactly.
EDS.
Yeah.
So it's like a, double whammy. And I've said that because I've had quite a few surgeries too. And I'm just like, intestinal surgery, bowel surgery is the worst
It
because you
is.
have to eat to stay alive. So
Yes.
eventually everything's got to come.
Oh,
Like if I had a surgery on my ankle, it's like, okay, that hurts and my ankle's in a cast,
yeah.
but I can eat. Like I can still process food and I can eat and everything because my ankle has nothing to do with that.
Right.
But intestinal surgeries do. And
Yes.
intestinal problems like gastroparesis. And I know one of the EDS people on Instagram, she's been in the hospital so much, more than she's been out of the hospital for like over a year now. And
Yeah.
gastroparesis and trying to get TPN right. And it's really, really hard. And, I would like people to understand that it's
Absolutely. Just the other
tremendously hard.
day, I was telling my husband, I'd rather live on TPN for the rest of my life than go through another surgery and have another ostomy or possibly another infection. TPN was, I hated it.
Yeah.
I hated TPN. But
And that's where they put the food in directly,
yeah,
like it
we're supposed.
bypasses your GI, right?
Yes, it goes in
And it
directly.
goes into the
Yes,
heart.
yes,
So
it
you
just
eat
keeps
with your
everything.
heart, essentially.
Yeah, if I have to do that, I have to do that. But then I'm like, no, I love food. I've
Yeah,
gotten to a
the
place where
taste and everything.
I can now eat certain things that I wasn't able to eat before. Over the past couple of years, I've been slowly implementing these things back into my diet.
Yeah,
But I don't know if I'm willing to take that risk, especially now with two kids. I can't put
yeah,
them through more scares. My
yeah,
children, they know they know that I'm sick. I just don't know how sick. And I try not to tell them too much, but like I said, I'm very honest with them. I don't want to scare them, and I don't want them to think into the future and think that I won't be there for the big things, for the graduations, for the weddings, the babies. And sometimes I get caught up in those moments too, where I'm like, am I gonna be here? Am I gonna be here because um, I don't know if maybe another surgery is my last, whether it be intestinal, orthopedic, whatever it is. Like I have a lot of risk factors here, so I don't know if
right.
that's but I have a lifetime of surgeries left, which is hard to think about because on the ortho side of it all with EDS, you constantly need surgeries.
Yeah,
Um, so I know they're not going to stop there, which is fine. I think I've accepted that. But then when we go back to the intestinal surgeries, I'd rather stay away from those for a little while.
yeah,
I'm just more scared than anything.
right.
I don't know
You
if,
have a daughter. When did she pop in with all this going on?
oh man, I've escaped death so many times that I think this is another one of those stories. But I was told for a long time that I wasn't going to be able to have any more children.
Right.
And I was never really okay with that either. I went into depression because of that as well. And listen, I'm very, very grateful to have had my one son. You know, during that point, I was like, I'm so grateful to have had him. At some point during my teenage years, I was told that I wouldn't have children at all. And I can't quite remember why, but I was told that. So I was like, okay, this is, he's my miracle. And honestly, yeah, if it weren't for him, I don't know if I would be alive, because I did a lot of fighting for him.
You were fighting for him.
Yeah. And with my daughter, my husband and I, we got married, and then we were like, we couldn't adopt because my medical history won't allow for it.
Yeah, right. Yeah. You're too risky.
Yeah.
Yeah.
Surrogacy in the state of New York, not really a possibility, unless it's someone, like a family member or a friend, and I didn't have that person that I could ask such a big favor to carry my baby. So we didn't really have any options, and I was like, I want to find a cardiologist and a team of doctors that will test me to see if I can have another child. And he was very against it at first. My husband, Julio, he was like, no, we're not going to risk your life. And I was like, we'll just ask.
Right.
And that's when I found my cardiologist, Dr. Graver, who I recommend to everyone. She is an amazing cardiologist, and she was the one that made it all happen. She's like, okay, I'm going to be upfront with you. You have a 33% chance of getting worse. You have a 33% chance of remaining the same. And you have a 33% chance of getting better. On a cardiac standpoint, of course.
It's like third. Yeah.
So we had gotten the green light from the colorectal surgeon. Her name is Dr. Heather Yo, for anybody who needs her in New York. She's amazing. She gave me the green light. She said everything inside will function okay, and if you get pregnant, things will shift and you'll be okay. So I was like, okay. She gave me the green light.
This was after the reversal.
Yes.
With the J pouch.
Yes.
Okay.
So she's the one that gave me kind of like hope. After that, I had an ovarian cyst that was filling up with blood, and it had to be surgically removed. So my OBGYN, he removed it, and he removed my IUD, and he's like, okay, I have endometriosis, so that's another ballgame. But he's like, everything.
That's a whole nother episode.
It is.
Really?
It is.
Yeah.
But he's like, you can try to have a baby, but you need to ask your cardiologist. So she was the last major step. And when she did all the testing and she gave me, the odds, and she gave us whatever, she said, you have my okay, just know that these are the risks, and you can start trying if you'd like, and we're going to have a high-risk pregnancy team for you, ready and waiting. So that's exactly what happened. At first, it took us a couple months, and I was kind of losing hope. It was so heartbreaking every month when I didn't come out pregnant, but eventually, I got pregnant. And then it was, oh my God, is she gonna,
Now you're, oh my God, I'm pregnant.
I'm pregnant, but is she gonna be okay?
It worked.
She or he, I didn't know. I was like, is the baby gonna be okay? Am I gonna survive this pregnancy? And I spent many, many nights just staring at my son, thinking, what have I done? Did I do something completely selfish by getting pregnant and possibly leaving him alone? Because if I don't survive this, what am I gonna? I had the chance to say no. I'm content with just him. I'm okay with it. But I wanted a girl. I wanted a baby. It didn't matter what it was. But I did want a little girl. And when COVID hit, because I was pregnant during COVID, and when COVID hit, oh my God,
the timing, it
was horrible. It made everything worse, and I was just told you can't go outside and you can't see anyone because you would die and your baby's gonna die. And I was like,
those were scary times.
What
I'll
is
tell
happening?
You. Oh my God.
It was terrible. It was like the PTSD and the fear of everything just heightened. And I was like, okay, protect at all costs. Like, protect this baby, protect myself.
Mm-hmm.
So I'm sorry, I'm jumping back and forth, but just a quick. My pregnancy with my son was high risk. I had a placental abruption, so they had to induce me to get
Oh,
him out.
yeah. That's
But
so
it was
serious.
scary. He was 36 weeks, but he was
Okay.
okay.
So he was cooked well.
He was he was
Yeah.
cooked well. He didn't crisp a little bit, but he was
Yeah.
okay. And
Oh my.
then, so I expected the same with my daughter, but I didn't get that. I got something else. I got intrahepatic cholestasis, um, and
Liver and
yes,
gallbladder.
yes, you
Yeah.
know it.
I know my medical
You
words too.
do.
Yeah.
So
Wow.
the first clue was I was itchy. I was itchy everywhere, and I was my hands and my feet, and
Yep.
my dog was licking my feet nonstop, and she was crying every time she couldn't lick me, and I was like, "What is going on with her? She's
Yeah.
telling me something because they know these dogs. They know.
Right.
They can sense and smell things, and it just started happening out of nowhere."
Yeah.
So I called my team, and they were like, "You need to come in right away." And I was like, "Okay, here we go." So they tested me for that, and they said, if it comes back positive, we need to take her out, because she's basically being poisoned by your own blood. And I was like, okay,
Yeah.
great. But it was in the middle of COVID, so everything was, you have to come upstairs by yourself. You have to do the test by yourself. You have to give birth by yourself. Just everything by yourself.
Yeah.
And I was terrified. So I was just like, okay. So comes out positive. They call me and they're like, okay, it's time. We're going to take her out today. And my mom is
How
freaking.
many weeks was
37.
okay.
37.
Okay.
So
Yeah.
cooked well also.
So like your son.
Like,
Yeah.
yeah. Um, and just the week prior, they were like, your husband can't be there. But that day, they allowed him to go in and be in the delivery room with me. I had the ICU, the CCU ready for me, the cardiac ICU, basically.
Yes.
And they had that ready for me. I had a cardiac team in my delivery room. And, I was being well monitored.
Right.
So I'm in labor, I was induced, and
Yeah.
I had my son naturally. So the goal was to have her naturally, especially because the C-section with my intestinal history was just very high risk.
Yeah.
But I see the nurse come in, she's checking the baby, and she just walks out. And I knew from her lack of words, because, they come in and they're like, okay, if you need anything, let me know, I'll be right there. She
Yeah.
just walked out very quickly, and my husband and I kind of sort of looked at each other, and he had been with me in the hospital so many times that he had learned what that means. That's an emergency. They just walk out quickly, and then when
Yep.
10, 12 doctors flooded the room, and they just put my stretcher back, and they're like, they weren't explaining what was happening, so they kind of just pushed him against the wall, and they needed space. And I'm just like, what's going on? What's going on? I see this doctor look at another doctor, and he's like he just went like that. He shook his head no and looked down, and I was like, what? So I started screaming, and I was like, the baby, save the baby, save the baby. And I look at my husband, and I was like, tell Aaron I love him. Aaron is my son. And in that moment, I was like, I'm not going to survive this, because they're like, we have to open you up. There's no operating rooms, and there's no colorectal surgeons on call right now. So we have to we have to do this however we can in this room, not an operating room. And we're just going to have to cut you now. So they're gearing up, they're putting everything on. And I'm like, okay, I'm not going to survive this. They're going to accidentally cut something that they're not going to cut. And, but at that point, again, I was like, okay, just save the baby. So what had happened was her heart rate went down, and they couldn't get it back up.
Yeah.
And all of a sudden, I get this nurse and another female doctor who's just like, wait, stop. They have the they have the scalpel in hand. So I was like, okay, they're cutting, but they're like, wait, stop. So she was just pushing down on my belly really hard, while the other one just stuck her hand right in to break my water to see if
Yeah.
that would help somehow. And they were pushing really hard. And then I hear like the Doppler and I hear the baby's heartbeat rising. And they were just like,
Oh,
wait, just wait.
yeah.
So that was a moment of panic. And honestly, again, I can't tell you how long it lasted, but for me, it was an eternity. Because I
Yeah.
was like, okay, this is it. And I chose the baby. I told them, I said, don't listen to my husband. Whatever he says, I don't care. Just save the baby. Whatever you
Yeah.
have to do, just take her out and make sure she's okay. Especially after hearing that no colorectal surgeons were on call.
Yeah.
I was just
Yeah.
like,
And then you're
there's
like,
no way. There's no way.
yeah. Oh my
So
God.
luckily for the nurse and that doctor, those two who saved our lives, and they told everybody to wait, and they tried that last maneuver and it worked, and her heart rate went back up, and then after that, labor sped up. And when she was born, they gave me moments with her, and she was okay, but they gave me moments with her, and then they had to take me to the CCU, and my husband had to leave, so I couldn't stay with her, but I remember they brought her in to see me in the CCU, and it was during COVID, so all the doctors and the nurses were emotional because they had seen so much loss. So in the
I was
CCU,
thinking that
they had seen
they
so
saw
much loss.
so much, and
And
you gave them hope.
yeah,
It was something they wanted to see, that they
right.
needed to see.
They did need to see. In the CCU, there were a lot of older patients.
Yeah.
It's rare to see somebody with
You were
heart.
probably the youngest one there,
It is. I was.
and the only one who had probably just given birth.
Exactly.
Oh
So
my
the
God.
moment because I was asking for her, I was like, please bring me my baby. I'm in a room to bring her in the little incubator box thingy. Like, she's going to be okay. And they're like, okay, yeah, we can do that for you. So I was the last room in the hall, and I could see the door straight ahead of me, like to the CCU. So they opened the door and they were bringing her to me, and they were kind of walking her down the hall, and all the doctors and the nurses, they lined up, and everybody was crying, and I was crying, and it was a moment of
Oh,
kind of like a little light for them too, because like I said, they had seen so much that seeing a little baby come in and having her just, they put her in my arms, and it
a
was just,
little pumpkin.
yeah. And she was a chunky little, oh my God, she was tiny, but she was chunky, and they put her in my arms, and it was hope, I think, for everyone. Um my husband, he slept in the car. He didn't want to go home. He was right
Yeah.
outside the window in the hospital, like he was there. He's like, I'm there, I'm here. I know I'm not allowed in, but I'm here.
Yeah.
But that was, her birth was traumatic, and I'm leaving out a lot of little details, because we don't have the time. I wish we had days to talk about
Yes.
it.
Oh my
um,
God.
but that's the gist of it. It was very scary. So as soon as she was born, a switch went off, and more fear and more PTSD and more anxiety turned on, to the point where I still struggle with leaving the house with just her. My son is 14. He's bigger than me now. He's huge. So
Yeah.
I'm, if in case of an emergency, he can handle himself, and he's like my bodyguard. But with her, I'm her protector, and I don't leave the house and without my husband or my son, because I feel exposed. I don't know if that, I'm working through it with my therapist, and 6 years later, I can't figure out why, but I think it was just a mix of my health, COVID, high-risk pregnancy, and then that birth, almost losing her when she was
Yeah.
born. So
Definitely.
now I'm just afraid of everything. I have agoraphobia. So trying to leave the house I leave the house, and I do everything that I can for my children and to give them a normal
Right.
life. So yes, we go out, but I panic. I panic, and I don't show it. So I'm always panicking in my mind. I'm like, what if this happens? What if that happens? I'm looking everywhere, and I'm like, who who is this person getting near me? Do they want my child? Things like that. Just
Yeah. If
crazy,
anybody
crazy.
has any reason to have those thoughts and feelings, it is
Yeah.
certainly you. I mean, and I think we all kind of chide ourselves for, oh my gosh, why am I so scared? This is silly. Or, oh my gosh, why am I depressed? I should be looking on the bright side. Oh God, I hear that. Or other people have it worse than you, or
God,
it could be
it
worse.
could be
And
worse.
all of that is just garbage, and it goes out the window because when it comes to chronic illness, as sepsis survivors, your experiences with giving birth and your miracle babies, every single one of us is different, unique, and an individual. And you have to do what you have to do to make it through each day.
Absolutely.
And other people maybe don't understand that. And you know what? You don't have to understand it.
That's fine.
Because it's the person themselves and how you're figuring out how to navigate life and everything. So it was after, I'm taking it that it was after your daughter's birth, then you got diagnosed with Ehlers-Danlos.
Yeah, I actually, she's
How did that happen?
So, I I went to, I had knee surgery twice because of a torn meniscus. Mind you, I'm not not an active person.
Telltale sign. Yeah.
I'm not an active person, so I'm like, okay. And then the hip pain started. And they're like, okay, you were born with a cam impingement, a deformity on your hip where when you rotate your hip, the bone is kind of scraping, and then that tore your labrum. So I had a torn labrum, and that pain is just, it goes into the groin, and it's terrible. So
Oh, God,
I
yeah.
was like, I don't understand why these things are happening. I'm not a runner. I don't bike. I do light exercise. If anything, it's just running after my kids, and that's it. But I saw my pain management, and I was going in for a spinal procedure because I have spinal stenosis. So I get the procedures to help with the pain. And
Yes.
I'm laying, and before he puts me to sleep, he's like, "There's something else going on with you. There's a bigger picture here. I think you need to see a specialist. Start with a rheumatologist." And I was like, "Okay." And then, he put me to sleep. He knocked me out, and I was like, "All right." So I woke up with that in mind. So I found a rheumatologist, and the first thing he says, he takes a look at my hands, and he's like, you have spider fingers." And I'm like,
Yes.
"Thank you."
There's a name for it, too. It starts with a T.
It's no, it's arachnid.
I can't think of it right now.
Arachnid. I'll think of it. It'll come to me.
Yeah.
Arachnid.
I'm going to Google it, too.
Arachnodactyly. I think it's arachnodactyly.
Tactily.
Arachnodactyly, if I'm not mistaken.
Yeah.
Arachnodactyly.
Now it's killing me.
I know. It's one of those things where it's like, ugh. So he tells me that.
You were right.
Arachnodactyly.
Yes, spider fingers, and it's not a T. It's, oh my God, I can't pronounce this. Arachnodactyly. Yes. You had it. You had it. You totally had it.
Something like that. And I'm like, okay. I don't like creepy crawlers.
Oh God, yeah.
But the only thing that I love spiders. Just so weird. Everybody's like,
my
"You're
gosh.
so weird." This is my phone.
I'm spider phobe.
This is my phone. Sorry, it's a spider. But I like spiders, and everybody's like, "But why? Why spiders?" And I'm like, "I don't know." So when he told me, I was like, "Okay, I can live with that. I like spiders." So I found it funny, and he's like, "You either have." Oh, so then he made me do the test. The
Beighton score.
The Beighton score.
Yeah.
So he's like,
how flexible are you?
I'm like, I'm very flexible. There's no end to it. I can do whatever. And he's like, okay, you either have Marfan's or you have EDS. So I'm like, okay, what? So he explained a little bit of both, and he just sent me home with like the pages of what to read and whatever. he's like, you need a geneticist. And I'm like, but they're hard to find. Luckily,
Yeah.
my cardiologist works with a geneticist, so I got one right away.
Oh, thank goodness.
I got one
Yeah.
right away, and she confirmed everything.
Yeah.
September of 2024.
Wow.
So
So you are fresh. You're a freshie.
very
I mean,
fresh.
like,
Yep. I
a new diagnosis.
I have a
Wow.
new diagnosis. And I was like, wow, everything makes sense. And then I went to all my specialists, and they said, yep, this is because of EDS. When I went back to my gastroenterologist, my colorectal surgeon actually, and I told her about my EDS diagnosis, she's like, that's exactly why your colon failed. We just needed to, a diagnosis, and now you have it, and that's exactly why. So all those
Because
years
the
that I
collagen
spent, yeah,
helps the intestines, holds them together, all of that,
and I spent years blaming myself. I was like, was it poor eating? Was it, bad choices as a teenager? Maybe like, I was beating myself up over it. Was it something that I did? Getting out of that office with a diagnosis, just not with a diagnosis, with just confirmation that it wasn't something that I did. It was something that I was born with. It was,
Yeah.
it was a happy moment for me, but at the same time, now I'm thinking about my children. Will they
Because
have
it's
this?
genetic.
Yeah.
Yeah.
Will they have
And
this?
both of my daughters have it.
They have. Oh, I'm sorry.
Yeah. I mean, they compensate very well. And my hope is that more awareness about EDS will
Absolutely.
encourage more research and more treatments, especially because, I mean, there's no cure. We basically navigate life, each and every one of us figuring out how to best do it
Yeah.
on our own, like right now.
Exactly.
So, yeah.
And I know that there's genetic testing to find out for all of the subcategories for EDS. And
Right.
my 14-year-old, he opted out of the testing. He said maybe when
Yeah.
I get older, but he's like, I'm not going to look for something when there's no pain, no signs. And I said, that's fine. That's your choice.
Right.
And then
Yeah.
we chose to do the same with the little one. Although, and I don't want to say this out loud, but she's very flexible. She's very hypermobile. And I look at her and I look at my husband sometimes when she does something and she does something too flexible, and I look at him and we look at each other and we're like,
Right.
But,
Yeah.
and something that their pediatrics said, which is very messed up, but he said once they get a diagnosis, the insurance company is going to start denying them everything. And once I got my diagnosis,
I'm not surprised.
yep.
Yeah.
Once I got my diagnosis, I got denied a lot of things. Little x-ray, tau blood test, or this and that. And I don't know why, but it happens. It happens a lot with EDS patients. So that's why another reason why we were like, okay, let's wait a little while to not have them tested. They're doing fine. So we're just going to wait until something shows itself, if it does. For now, they're okay, but I do worry about them because of the genetic component. So getting this diagnosis was a breakthrough, but at the same time, I feel like I don't know, my family was condemned, I don't want to pass this on to them. And as a mom, you understand your daughters have it. And I think something that we have to remind ourselves too is just, it's not our fault. We got it from our genetics, and it wasn't their fault either. It's just something that happened.
And just imagine if the planet didn't have people like us in it, on it,
Right?
I mean, everybody brings something to the table, and
Absolutely.
more often than not, look, 129 million people in the U.S. alone have chronic conditions, whether it's EDS, diabetes, high blood pressure, cancer, and for whatever intents and purposes, we are contributing a lot.
Absolutely.
And you are an absolute queen doing what you do and have been dealing with since very young. I mean, it's mind-boggling the amount of surgeries, the congestive heart failure, having your miracle babies, and all the things that you've been through. And now the cherry on the top is you get the EDS diagnosis too, on top of all of that. But I agree with, your doctors are right. I mean, a lot of these problems came because of EDS.
Yeah.
Because it's crazy how often it affects the gastrointestinal system.
Right.
And way too many people who don't have EDS think that it's just being bendy.
Right. You're just
You
bendy
know,
and flexible.
doing party tricks.
Exactly. All of my
Yeah.
party tricks now, I look back and I'm like, wow, they're, you know,
Yeah.
it's just I can do things that nobody can do, and it was cool. Yeah, but I mean, it hurts now. I can still do it,
Right.
and it just hurts. And
I'm still fairly flexible. As you age, you will stay flexible. I can guarantee you.
okay.
I mean, and it works to your advantage sometimes. Sometimes it doesn't. You see me on Instagram. I spend a lot of time. All of my time actually is exercising is done
You
in the
walk
water.
a lot.
And I used to walk a lot more, but my osteoporosis got the better of my shins, so I decided to avoid needing like rods or anything inserted into my shins, and I spend all of my time now in the water. I'll walk on my walking pad like a mile or so a day, and kind of limit it at that, but most of my steps are accrued in the water because it's safer and
Of
it
course.
protects my joints.
Yes.
And it relieves my pain,
Yeah.
so I'm not,
Yes.
I go for it.
Yeah, I am waiting for the
Yeah.
weather to get a little bit warmer here, so that I can get into a pool, and just
Yes.
because it does help with pain. It helps a lot with pain. You're weightless in water,
my
so
God,
it helps.
Yeah.
And I
And
like
it's more like supportive even. Like,
yes,
you don't have to worry about falling for
right.
dislocating as much,
Oh my God, I
yeah.
fall all the time. So I'm just walking and my hip will give out, and then boom, I just
Yeah.
I laugh at it because
And there
it's
you
like,
go.
yeah. And my kids
Yeah.
are like, what's going on? Like everybody rushes to pick me up. My husband already knows. My kids already know, and I just laugh it off because it's pain. It hurts when your hip pops out of place. But I
Yeah.
I
Yeah.
just try to hide it, which is really hard. Trying to hide the pain from them. There are times when I just sit in the tub, during my shower, and I'm just okay, let's let it out here. Or when they get to bed and I'm finally able to take a pill, my medication, and just let it all out. My kids are very active. They play a lot of sports. It's a lot of running around with their sports, and it's a lot of, we got to go here, we got to go there. And it's a lot. My days are very painful. Sometimes getting up in the morning seems impossible. And sometimes all they have to do is look at me and they're like, "You're in pain, mommy, aren't you?" And I'm like, "Yeah, but it's okay. I got this. Like I can do this. I'm okay." My back lately has been horrible, and I'm more open with my son because he's seen more. He's older. He's experienced this with me since he was very little. With my daughter's very sensitive, so I tend to hold back a lot. But sometimes when she says, "Mommy, is it your back? Mommy, is it your hip?" Or she'll say, "Mommy, sit down. I know you're in pain." And it hurts me because I don't want my kids to have to take care of me. I want them to live a long, full, happy childhood and their lives, and I don't want them to have to think that their job is to take care of me. So it's a lot of hiding my pain in front of them so that I can be there present as a mom. Not only not only physical, it's a lot of hiding the mental aspect of it too, because it's just, it's typical.
Yeah.
Yeah.
Listening to you talk, it reminds me of when my kids were little and I was in the hospital a lot and everything. And man, I went so hard in on myself because you don't feel like you're being a good mom if you're in the hospital. You don't feel like, you're being the best mom that you can be when you're sick and you have to spend the day on the couch or 2 days on the couch, or I would be in the bathroom vomiting nonstop for a day or two. But I don't know if this helps, but my kids are all in their 20s now. My son's in his early 30s, and They're some of the most empathetic people I've ever seen. They care about other people. They still try. I call my youngest daughter my warden because, yeah, she watches over me a lot. So I'm like, oh, the warden says I got to do this now. So, but they, again, healthy people may not get this, but chronically ill people contribute so much to the state of human existence, I think, and enriching the very reasons like that we're here, like to care about each other and to help each other and to have understanding for one another. You know, I mean, we just, we are worthy, I guess, is what I'm trying to say, because we spend a lot of time thinking we're not. We are worthy. Everyone listening is worthy. All the people I always tell on Instagram, you're worthy. You mean something. You need to be here. And we're here. And we're humans, and we're not infallible, and we're going to have problems. We're going to have health problems.
Yeah.
Everybody is eventually going to have a health problem. But I think that we embrace life with a uniqueness, and our children do too.
Yeah.
That other people just can't grasp, but
Absolutely.
we embrace it with a real uniqueness that makes us flourish, that makes us, you know, have a reason to be here and exist.
That was,
and have other people care.
yeah, that was beautiful. Thank you. I mean, you know, you get
Your
it.
kids are going to be fine.
Yeah, and they're very empathetic too. They are, and I see it in it in them, and you know, you have your warden, and I think that's beautiful because I have mine. My son is he gets mad at me if I drop something and I don't ask him to pick it up. You know, he's like, I'm right here. Why didn't you ask me? And I'm just like, I
He's
don't
in
know.
training for sure.
So he's my little warden, and it is a beautiful thing. And yes, they do have a lot of empathy. But you're right. We bring so much to the conversation. And you know, it's just I do wear my stripes proudly. So
I was going to say, I'm glad, because I did want to end on that note, actually. So she's got this really cool zebra shirt and a very cool zebra blanket, which, talking about messages life gives you, want to tell our audience about the blanket, please?
Yes. So my watch is also a zebra, but
everything
I have, yeah. So, you know, it sparks conversation, and people ask, oh, you like zebras? Well, just so happens I'm a zebra.
Have to.
So this blanket, and a lot of things that I have, actually, bed sheets and a comforter, I've had since I was 14. And I was always attracted to zebra print, and I, you know, just one of those things where I still have these, and I pull them out now because I'm a zebra myself. But it's like, looking back, I was like, wow, I think life was trying to tell me that I'm a zebra. You know, I was always attracted to stripies and zebras, and I have like a little zebra toy, and just the littlest things that I've kept from my childhood, I still have, and I'm like, wow, that was a sign all along. I think, I don't know, I may be crazy, but you know, I think that
it's not crazy.
I think that there are signs everywhere.
Absolutely not.
Yeah.
Life gives us little messages.
I think so. Absolutely. Yeah. Absolutely.
But that is the coolest thing.
It is.
And it's, you know,
it's just so cool because it reminds me of my childhood and everything that I went through as a teenager. And it makes me think back on that, and just little things like that now I can look out for with my kids, you know? So I think it's just full circle, you know?
We put some incredible humans on this planet, girl, I'll tell you.
Thank you. Thank you so much.
And you are incredible.
So are you. I mean, what you're doing for the community, your podcasts, I know it takes a lot of work. I'm so sorry that I had to reschedule from yesterday. but I can't
No worry.
imagine.
Remember what I said.
I
We
know,
don't
I
apologize.
know.
Chronic illness, we don't
Oh,
apologize
and that's what I
because
appreciate.
it is what it is, you know?
Absolutely. And I've met a lot
Yeah.
of people on Instagram. It's such a great way to connect with people going through the same thing. And one thing that we
Yeah.
always tell each other is, "Hey, I'm sorry I'm 2 weeks late getting back to this message." And it's like,
Yeah.
"No worries. We'll just pick up where we left off."
Everybody gets it.
We
Yeah.
know, we know how hard it is. We know, we know.
Yeah.
So thank you for that. And you are amazing, and I'm so glad that I have met you. I wish I had met you sooner, but we're here now. And I thank
We
you so
are.
much.
Yep. Well, thank you, Giselle. I know, again, I know you've been struggling, and to be here and to have this chat with me and to help enrich our community and help encourage understanding of those who don't have a chronic condition is just, what it's like. And you're just a total badass, and
Thank
you're
you.
doing amazing. You're doing amazing
Thank
things,
you.
and you're raising awareness, and you are very well spoken. I mean, public speaking, I think, is in your
Oh,
cards.
thank you. I'm trying. I'm trying. And sometimes
You are wonderful.
thank
Yeah.
you so much. Sometimes I am a little absent on Instagram, and just I want to put it out there. I have kids, and you have a teenager, and it's hard at this age.
Yeah.
And I have my
Yeah,
little
because you
one.
got to take care of them first.
Yeah,
Sure.
and it's a
Yeah.
lot. So we've been
Yeah.
through it recently, but I'm here always. And I always tell people, call me, and I always pick up, always. So if you ever need me, if there's ever a crisis, if you want to break down, cry, scream, laugh, whatever, I'm here. So
We hold each other up and we raise each other up, for sure.
absolutely,
Yeah.
thank you.
Thank you so much, Giselle, and thank you, audience, for tuning in to this wonderful episode. And, it's just amazing with my guest here. And I want to remind everybody, I do my little PR, or not, it's not really PR at the end, a little word of caution. This is not medical advice. This episode is for information purposes only. So remember, when you have a medical emergency, you call 911, your doctor, or get to the local ER. So just always want to put that out there, and thank everybody. Thank all of you again for subscribing, for tuning in, and for being here with us and being a part of the conversation. So thank you, and thank you,
Thank you
Giselle.
so much, Jackie. Thank you.
Yeah.